Hi everyone, I am Dr. Amrika Sheshadri. I'm a plastic surgeon. In this video, I'm actually trying to explain to you what is it to expect when you come in for your dimple creation. Number one, you must not drink or smoke for at least 6 weeks before the procedure. This is very, very important for healing. Number two, you should not have uncontrolled diabetes mellitus or sugar problems as they call it, and then you shouldn't have too many BP problems or uncontrolled health issues because that may delay healing. Number three, before you come, you'll be given a prescription for a chlorhexidine mouthwash. So you have to use 1:1 dilution mouthwash. Rinse your mouth out very thoroughly, at least one night before and then the day before the procedure, and then you come for the procedure at around 11 o'clock so that you can leave at around 12:30. So this is like a typical timeline. From when you come in, it takes about 1.5 hours to go back. Whether you choose to go back to work or you choose to go back to home is completely your call. Anyway, so we also give you a list of precautions to be taken, which is after the procedure, but that we'll cover in some time. During the procedure, the one problem that I have faced as a surgeon and my patients have faced is that they don't always know what they want. So they know they want dimples, but they don't always know whether they want a long dimple or a pinpoint dimple, both sides, long both sides, asymmetric, closer to the chin. So in this case, I do use some amount of discretion and I do tell them that this is the kind of dimple that would suit you best. Most people are very, very happy with the location, and I'll show you how I do the deciding and how I do the marking. We analyze the face overall and then we draw a line starting from the corner of the mouth all the way till the ear. So this is it's slightly curved line. It's not a straight line like this. It's a slightly curved line. Then we look for the position of the outer part of the eye, this corner of the eye, and this we drop straight down. And so there is a point where this curved line and the straight line meet. This is where they meet. And so I keep my cotton bud here and I say, oh, can I have a smile, please? And so smile, big smile, fake smile. Okay, can you see this depression? This is actually where the dimple would ideally sit. And so this has to go completely in when she smiles. And then can you relax your face now? And then relax more, like don't smile, serious look. And so it should absolutely disappear when she's not smiling. So this is naturally that junction. Can you give me a big smile again? Full teeth smile. Yeah, that is the ideal position. And for her face type, instead of a pinpoint Preeti Zinta kind of dimple, I think she would do really well with a slightly longer, more diagonally oriented dimple. I mean, that's just my opinion. You can choose what you like, but I would really prefer to have a diagonal dimple on her. After the procedure, your mouth will be sore and little numb. It's, obviously I haven't had dimpleplasty done, but what my patients tell me is that the procedure is akin to having a tooth removed, although not quite so painful, because the soreness that is there fades over a course of hours rather than days. There's always an aspect of healing, so plastic surgery is not instantaneous. So dimpleplasty is also not instantaneous permanent result. In the initial stage, what happens is that when we create a dimple, we take stitches through the inner part of the mouth, the mucosa, along the muscle into the deeper layer of the skin called the dermis, and then we come out the other way. So all the knotting and the tying is done inside. On the skin though, there will be a dent, and this dent, which is the future dimple, is going to be stuck in place. It's not truly stuck. It'll look like it's stuck in place for 6 weeks. At the end of 6 weeks, what you'll notice is that your dimples only appear when you smile, and then they disappear when you relax your face. And this is the look we're really trying to achieve. We don't want unnatural looking, hollowed looking cheeks, which is not a good look. We're trying to create a dynamic, soft, natural looking dimple. And like I said, since this is customized and customizable, you can always have asymmetric dimples, which are kind of my favorite to create, where you have like one which is a little deeper and then the other which is a bit of a line-like thing. So if you have any questions about this procedure, or if you feel, am I the right candidate for this, or do you feel that yes, this is something that I'm lacking, like my friends have this dimple or my colleagues have this dimple and I really think this is gonna help me look better in my photos or feel more confident in your day-to-day life, then this is something that I would say it's one of the most underrated procedures to get done, because one subtle change and your entire face, your smile completely changes out. So until next time, remember to share, like and follow, and drop a comment below if you know someone who has dimples.